Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to the Hope Natural Health podcast, where I try to get you healthy the right way. Last week, we had one incredible special guest, Carrie V. You do not want to miss this episode. We talk about why age doesn't matter, how you can practice gratitude, and how you can really ride the waves of life and get back on track. So go back and listen to that episode. This week, we're going to be talking about birth control. I help tons of women in my practice regarding the pill, and I would say a rough 70% of women that come into my practice are on birth control, whether that's the pill or the IUD. And a lot of these women are on the pill for the wrong reasons, things that aren't even related to birth control, which makes zero sense in my mind because the pill is used for birth control. It's not to be used for irregular periods, acne, PMS symptoms like cramps. Like, the pill does not treat these things. So if you get anything out of the podcast today, know that the pill is simply just going to be masking the symptoms. It's like a Band-Aid. So if you're on the pill for any of those, acne, irregular periods, heavy flow, terrible PMS, what happens when you come off the pill? You're going to have all those symptoms back. So I am a huge advocate for it. Let's get to the root cause as to why you have the irregular periods. Why do you have the acne? Why do you have the PMS symptoms? There's reasons for these. And the pill, just like caffeine fixes energy, or Ambien fixes poor sleep, or duct tape fixes sleep. Much like caffeine fixes energy, why Ambien fixes insomnia, or duct tape fixes a leaky pipe. These are all just Band-Aids. They're not going to get to the root cause. And your mainstream doctor is not going to tell you these things about the birth control pill. So I want to tell you some of the seven different side effects that the pill can cause that you might not be aware of or your doctor has not told you. So the pill might increase your risk of cancer. So it does technically reduce the chance of endometrial cancer and ovarian cancer. It has been linked to breast cancer, cervical cancer, and liver cancer. So tit for tat, may cause some, may prevent another one. I highly just think that anything nowadays can literally increase your risk of cancer, anything that you put, hormonal birth control, etc. So it might increase your risk of cancer. That's one little side effect of the pill. Second is it actually lowers your testosterone. Now, a lot of birth control has estrogen or progesterone or both in it, and it's the synthetic form of those hormones. Doesn't have any testosterone in it, but it can actually lower your testosterone. So this, therefore, can decrease your libido, your energy, your muscle tone, and you might actually experience less lubrication from this, therefore increasing pelvic pain, and actually might have trouble getting an orgasm if you're on the pill. Who wants that? Nobody. So the pill can actually lower your testosterone. It does actually cause mood disorders, and I see this clinically all the time where patients used to not have any issues with anxiety or depression, and now that they're on the pill, they have these sorts of problems. So PMS can also cause this, but the pill can also increase your mood swings, your depression, or your anxiety when you're on the pill. So keep that in mind if you are experiencing these symptoms. It might be due to the pill. The pill also increases your risk of blood clotting, heart attack, and stroke. So this was something that came up in the media recently with one of the vaccines for COVID-19, the J&J shot that was causing blood clots. And now it's not recommended for anyone that is on oral birth control, likely because of this reason. So these clots have been long associated with with the birth control, and especially If you are a smoker, overweight, or you're over 35, that puts you at an actual increased risk of developing these clots. Number 6 it contributes to nutrient deficiencies. B12 and magnesium are probably the top 2 nutrients that are depleted with birth control. Plus, it can also deplete our gut microbiome. It can cause what's known as leaky gut. I've talked multiple times about leaky gut and our absorption to essential nutrients that we might be getting through our diet. So know that you might not have a good nutrient status if you're taking the pill, and we have to replete you with these nutrients. Also, your liver is needed to metabolize medications, and we need these nutrients to help your liver do its job. So if you don't have the nutrients for your liver, then we're going to have trouble there too. So keep that in mind. And last, it can actually delay fertility. So when we take the pill, it cuts off the communication between your brain and your ovaries to do anything. So you're not ovulating. And when you're not ovulating, you can't get pregnant, which is the mechanism of the pill. So if you go off the pill and then you get your period back, you might have issues with fertility because your brain is trying to figure out what to do, and you might have what's known as anovulation. You might not ovulate. So keep that in mind with fertility if you're trying to prevent pregnancy and then all of a sudden you're like, okay, I'm ready to have children. The pill might actually delay your fertility to some extent. So I wanted to come on here because I've gotten a lot of questions about the pill, and in the office, women are not aware of, the signs and symptoms or even the side effects of taking this medication. So I wanted to point them out to you. Just a brief recap. It might increase your risk of cancer. It screws up your gut. Actually, I think I forgot that one, but I touched on it with the leaky gut. It lowers your testosterone. It causes mood disorders. It increases your risk of blood clotting. It contributes to nutrient deficiencies, and it can actually delay fertility. So if you listen to this, I would love to know which one was most surprising to you. And you can send me a message, you can comment, share this to your page, and tell other viewers that might be interested in listening to this. Tell them about it so they can listen to it too. As always, I appreciate you being here, and we'll see you all next week.